You have been to the doctor and you have been told you have a breast cyst, or perhaps even more than just one cyst. So, what are breast cysts? Are they dangerous and could they turn into a cancer? Hi, if you are new to the channel, my name is Tasha Gandhi, here to help you navigate the world of health in general and breast health specifically. So, what are breast cysts? Breast cysts are like little sacs filled with fluid that can develop in the breast tissue. In fact, they can also develop anywhere in the body. They can develop in ovaries, liver, pancreas, your lung, kidneys, to name but a few. Cysts are quite common, especially in women. They can appear quite suddenly and present as an obvious lump to feel. The truth is though, most of us have breast cysts, but because they are so small, they are not palpable. Breast cysts can appear in just one breast or in fact both breasts, and it is not unusual to have multiple cysts in the same breast. So, why do they occur? The exact etiology of breast cysts remains incompletely understood, but hormonal factors play a significant role in their development. Fluctuations in estrogen and progesterone levels during menstrual cycles and the menopause contribute to the formation and enlargement of cysts. Additionally, genetic predisposition, age, and reproductive history may influence an individual's susceptibility to developing breast cysts. So, how do they show up? Well, usually you'll notice a lump in your breast that feels smooth and moves around when you touch it. Sometimes it might feel a little bit sore or tender, especially when your hormones are doing their thing. However, it is not uncommon to incidentally find cysts on ultrasound scans or mammograms. And these cysts are normally very small that you would not be able to feel them. It's essential to get any changes in your breast checked out by a doctor. And remember, just because you have found a lump doesn't mean it is always something worrying. So, how do you diagnose breast cysts? As always, you have to get it checked out by a doctor in the first instance. And the diagnosis of breast cysts typically involves a combination of clinical examination or assessment as well as imaging. A breast cyst does have particular characteristics, not only when we feel it, but also on imaging, either on a mammogram or on an ultrasound scan. And I get asked quite a lot as to how can one tell whether a lump is benign, in other words, not cancerous, or whether a lump is a cancer. And our radiology colleagues are very good at telling the difference between the various conditions because they actually look quite different on the images. An ultrasound scan is particularly useful in distinguishing between fluid-filled cysts and solid masses, guiding needle aspiration procedures, and monitoring cyst size and composition over time. A fine needle aspiration or FNA or a core needle biopsy may be performed to obtain cytological or histological samples for further analysis and confirmation of a diagnosis. So, what can be done about breast cysts? Well, if the cyst isn't bothering you too much and it isn't too big, your doctor might say to you, you don't need to do anything at all. Just leave them alone. They might suggest to keep an eye on it to make sure it doesn't change over time. But if the breast cyst is causing you pain, or it keeps coming back, or if it is quite large, then they might suggest draining the fluid from it with a tiny needle and syringe. And it does sound scarier than it is, but it can give you symptom relief. So, do breast cysts become cancerous and are they safe to be left alone? Yes, we know breast cysts are very common, they don't become cancerous, and they can be safely left alone. I hope this has been helpful, and I'll see you in the next one.